The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody, and welcome to our first in the series of 6 webinars on lipid control. It is called Beyond the Numbers, and I am Andrea Baer, the Executive Director for Mended Hearts, and I'm very excited to be here with you all today. The first thing we're going to do, and we're going to start off with a poll. If you look in your little white chat box, there is a poll that is just launching, and I'd like you guys to answer it on how comfortable you feel in scheduling a telemedicine visit. So as everybody is answering, I'm going to go ahead and get started. So the Beyond the Numbers webinar series is designed from Mended Hearts, the National Lipid Association, and the foundation of the National Lipid Association. Mended Hearts' mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. The National Lipid Association mission is to enhance the practice of lipid management in clinical medicine, and the foundation of the NLA's mission is to improve the welfare of patients and families affected by cholesterol and high and triglyceride problems. And I'm joined today by Dr. Kulkarni, who is a fellow of cardiovascular diseases at Washington University in St. Louis, Missouri. And I am Andrea Baer, and the executive director, and I will be moderating this webinar. I want to remind everybody that you are in listen-only mode, so you are all muted. If you have a question, I encourage you to ask the question in the chat box. You can type it in at any time during the webinar, and when it comes time for question and answers, we will read the question and get the answer for you. So feel free to use that chat box anytime you'd like. If you are uncomfortable with the chat box and would still like to ask a question, you can raise your hand by clicking on the little hand icon beside your name, and that will alert me that you have a question. If we have time during the question and answer and I am unable to unmute you, I will do so and let you ask your question verbally. So the poll is in progress. Hopefully everybody has answered. And it's interesting because we are almost a 50-50 split with very comfortable and somewhat comfortable, with only 10%, 11% of people feeling somewhat uncomfortable and 8% feeling uncomfortable. So it's an interesting spread. And I bet that I can speak for other people when I say that since COVID-19 has come around, that is my very first time that I've ever done telemedicine visit myself. And so probably other people feel the same way. But I will turn this over now to Dr. Kulkarni, and she is going to talk to us about staying healthy in the era of COVID-19. Dr. Kulkarni.
Thank you for that introduction, Andrea. If I could get my slides pulled up.
Can you see my screen, Dr. Kulkarni?
No, I can't.
Okay. Well, it says people can see my screen. Hang on one moment with this technical difficulty that we're having, and I'm going
Andrea, see if you can close the poll.
There we go.
Ah, sorry about that. Now, since we're back on track, we can go ahead and get started. Thank you.
All right. So thank you again for that introduction. Today, I'm going to talk to you about staying healthy in the era of COVID-19. I have no disclosures. So we live in an era where COVID-19 has taken over our lives. Almost every aspect has been affected by this global pandemic. The pandemic has been a cause of stress for all. Many people find themselves juggling new responsibilities, such as working from home while raising and even homeschooling their children. It has been even more difficult to stay in shape with the social distancing restriction. Some people have substantially cut back on their work hours and now have financial concerns. Finally, in-person social interaction has also been limited due to restrictions on travel and the implementation of social distancing. We are all juggling our own assortment of stressors. While this is a particularly challenging situation for all involved, I'd like to highlight some of the ways in which we can make the best of the situation and prioritize prevention and cardiovascular health. Heart disease is the leading cause of death for men and women in the United States. Risk factors for cardiovascular disease include hypertension or high blood pressure, diabetes, smoking, high or bad cholesterol, also known as low-density lipoprotein or LDL cholesterol, obesity, and physical inactivity. It is important to note that individuals with cardiovascular disease or its risk factors are particularly vulnerable to COVID-19 and can have worse clinical outcomes, particularly if they have hypertension, diabetes, or obesity. I'm going to structure today's talk using the Biopsychosocial model, an interdisciplinary model developed by George Engel that looks at the interconnection between biology, psychology, and socio-environmental factors. We will start out by discussing the bio aspect of this that focuses on physical health. The American Heart Association proposes 7 simple metrics entitled Life Simple 7 that are designed to keep one on track towards a healthy lifestyle. Life Simple 7 encourages patients to stop smoking, get or remain active, control cholesterol, manage blood pressure, eat a healthy diet, lose weight, and reduce blood sugar. The 2 aspects that we're going to focus on today are getting or staying active and eating healthy. However, along the way, of discussing those metrics, we will indirectly address some of the other metrics from Life's Simple 7. The first metric is getting or staying active. The 2019 American College of Cardiology and American Heart Association guideline on the primary prevention of cardiovascular disease recommends 150 minutes or more a week of moderate intensity or 75 minutes or more a week of vigorous physical activity. In addition, the American Heart Association recommends walking 10,000 steps or approximately 5 miles a day. How do we meet this goal? You can do it with either 30 minutes a day, 5 days a week of moderate intensity activity, or 25 minutes a day, 3 days a week of vigorous intensity aerobic activity. The most important thing is to do something active every day. Staying active has long-term beneficial effects on blood pressure, cholesterol levels, weight loss, and stress levels. Suggestions for moderate intensity aerobic activity include brisk walking, light effort bicycling, yoga, Zumba, and dance. Vigorous aerobic physical activity includes hiking on trails with steeper inclines, jogging, fast bicycling, or singles tennis. There is ample opportunity to make the most of technology during this time. Workout apps can be downloaded to encourage or monitor physical activity. Online video workout sessions can help guide your exercise routine, and wearable devices can assist in tracking workout metrics. I would encourage the use of any or all of these devices to stay on track. I'd like to now shift gears to talking about healthy eating. The 2019 American College of Cardiology and American Heart Association guideline on the primary prevention for cardiovascular disease recommends a diet that emphasizes the intake of vegetables, fruits, legumes, nuts, whole grains, and fish to decrease the risk of heart disease. Other recommendations from this guideline include replacing saturated fats with mono or polyunsaturated fats, reducing the amount of cholesterol and sodium in the diet, and minimizing the intake of processed meats, refined carbohydrates, and sweetened beverages. Let's take a deeper dive into this. The National Lipid Association provides online resources that help structure healthy eating. Here's an example from some of their educational materials that are available at lipid.org. When consuming fruit, choose whole fruit instead of juice. Heart-healthy fats include vegetable oils such as canola, corn, olive, and safflower. Water should be the main beverage throughout the day. Moderate amounts of coffee or unsweetened tea are acceptable. Dairy or non-dairy alternatives should include fat-free or 1% milk products or calcium-fortified soy milk. Finally, the use of herbs and spices may reduce the need for using salt when cooking. When planning a heart-healthy meal, using a 9-inch plate can help with portion control. Fill half of your plate with non-starchy vegetables that are low in calorie, nutritious, and help you feel full. 1/4 with lean meat or plant-based proteins, fish, poultry, soy, or legumes. 1/4 with whole grains such as oats, quinoa, or brown rice, and starchy vegetables such as peas, potatoes, yams, or corn. There are ways in which you can tailor your diet to focus on lowering bad cholesterol and triglycerides. To lower your low-density lipoprotein or bad cholesterol, replace saturated fat by eating lean meats and low-fat dairy products. Replace saturated fats like butter and coconut oil with healthy fats such as canola oil, olive oil, avocados, and nuts and seeds. Limit cholesterol intake to less than 200 milligrams a day by limiting egg yolks to 2 to 4 times a week and cutting back on red meat. Avoid sugary beverages and reduce the intake of sugary foods to help lower triglycerides and achieve a healthy weight. The American Heart Association provides some great heart-healthy recipes on their website, heart.org. For example, if you are an avocado lover, here's a list of board-certified recipes using avocados that are recommended by the AHA. Many of us have had to shoulder the burden of working and parenting around the clock, so I'd like to take a couple minutes to focus on engaging children in exercise and healthy eating. 13.7 million, or 18.5% of children and adolescents ages 2 to 19 are obese. I'd like to take a minute to let that sink in. That is nearly 1/5 of children and adolescents that are obese. Obese children are at high risk for other chronic health conditions, asthma, sleep apnea, bone and joint problems, and type 2 diabetes. Children with obesity have more risk factors for heart disease than their normal weight peers, such as high blood pressure and high cholesterol. Here's a figure from a paper that discusses the importance of promoting healthy habits during childhood. Successful health promotion initiatives should use a multi-level, multi-component educational approach that starts early and is maintained throughout the development of the child. Families play a crucial role in instilling healthy habits. This table provides a guide to the amount and type of physical activity that is recommended for children of all ages. It ranges from 30 minutes of tummy time for infants to 3 or more hours for toddlers and preschoolers, and 60 minutes or more of physical activity, including muscle and bone strengthening activities for elementary and middle school children, as well as teenagers. Fitness can be fun. Here are some suggestions for making it enjoyable. Go outside, play in the backyard, walk, go for a bike ride or rollerblade, have a dance party, have a family fitness challenge. Teens can virtually work out with their friends. And most importantly, try to limit sedentary and screen time as much as possible. Healthy eating is also important during this time. Cook healthy meals together, schedule snack times, and stock up on healthy snacks to prevent overindulging or constantly grazing. Fruits, vegetables, and whole grains are key. Avoid sugary beverages, and hydrate, hydrate, hydrate. It is important for everyone to maintain healthy routines, especially during the pandemic. It is important to stick to your medication regimen, particularly for patients with chronic medical conditions. Make sure to call your doctor's office and touch base with your pharmacist before you run out of your prescription medications. Continue to communicate with your physicians and care providers. Telemedicine is a great option that has emerged quite robustly during the pandemic. And as we saw from the poll that Andrea did earlier, it seems like a lot of people are fairly comfortable with telemedicine already. For any of you who are unsure of what telemedicine is, it is real-time audio-visual communication tools that connect physicians and patients, and remote patient monitoring tools such as blood pressure monitors and wearable devices that can communicate biometric data. What this means is that you can visit with your doctor from the comfort of your home using online communication tools like Skype or Zoom. This has been particularly successful during the pandemic as it limits exposures, is convenient, and most importantly, allows you to stay up to date and in contact with your doctor. I would like to emphasize the importance of staying connected with your physician or provider. If you are interested in setting up a telemedicine visit, call your doctor's office to see if they can assist you with this. Now that we have talked about physical health, I'm going to refer you back to this biopsychosocial model. I will now add the social aspect of this model onto what we already discussed with the bio aspect. This is a socially and emotionally challenging time for everyone, and the importance of staying connected with friends and family cannot be emphasized enough. While in-person visits may be substantially limited, there are ways to remain socially connected. Some suggestions include completing workouts, routines virtually with friends and family, incorporating friends and family into a fitness challenge, cooking heart-healthy meals as a family, doing a recipe swap and trying new recipes. Cooking with children allows for family bonding and the opportunity to teach them new skills. And sharing thoughts and experiences, play virtual games, or start a virtual book club. Finally, I'm going to complete this model by bringing in the psychological aspect of it and focusing on mental health. As we have said before, these are trying times. Some action items that can set you up for success include trying to keep a daily routine, setting a schedule for the day or week that includes a mix of pleasurable and productive activities, and trying to keep a balance of physical, social, and work-related activities. I cannot emphasize enough that it is okay to feel frustrated. We have all felt that way, so remember that you are not alone. Reach out to friends and family for support. Many of them are feeling the same stressors and emotions that you are. Most importantly, if more serious feelings of depression or anxiety arise, contact your doctor or healthcare provider for assistance. I want to highlight some great resources from the Substance Abuse and Mental Health Services Administration. Here's the contact information for their Disaster Distress Helpline, National Helpline, and National Suicide Prevention Lifeline. There are also some resources to help find treatment locations in your area. With that, I would like to conclude our journey through the biopsychosocial model of staying healthy in the era of COVID-19. If there is one message that I would like to leave you with today, it is that we are all in this together, and together we can brave any challenges that are thrown our way. Thank you.
Thank you so much. What a great information and lots of good stuff there. So now we are going to go into our question and answer period. I know that we have some questions already coming up and some hands raised, but what I would like to do is get the questions first, and then if we have time, we'll grab the answers from or if we have time, we'll grab the questions from the hands. So someone says there's a huge disconnect between 10,000 steps and the recommended number of minutes of easy or vigorous exercise that is being recommended. 10,000 steps equals about 5 miles of walking. That takes about 2 hours. Is there any advice you have for why they say, I know they do say 10,000 steps and that's a lot, it seems to me. Or is the regular activity exercise changed if you're not doing steps? So like if you do aerobic activity for 30 minutes, does that count as more steps?
Sure, that's a great question. So the 10,000 steps are really just a guideline of how many steps you might want to shoot for during the day. And that could include leisurely walking. It doesn't necessarily mean that it's moderate physical activity. So even if you have, like a step counter on your phone or something like that to help you track your steps, that's just a really nice metric to try to target, even including leisurely activity. And superimposed on that, the 30 minutes a day or 25 minutes of moderate intensity or vigorous physical activity is recommended on top.
Gotcha. So the next question is, if you're not able to do the exercising and vigorous aerobic activity, do you have any suggestions for how to stay active if you are physically unable to do so?
Sure. So exercise routines can be tailored towards people's restrictions and limitations. The overarching goal is that we want to focus on increasing activity and doing what you can safely and comfortably do. So some options for that include activities like Tai Chi, doing yoga, chair yoga specifically, breaking down the exercise sessions into smaller chunks. 30 minutes at a time can be quite a bit for some people. So maybe 10-minute sessions might help break that apart during the day and just gradually increasing. So even if you can take an extra flight of stairs during the day or walk an additional 10 or 20 steps, you're making progress towards that goal.
Great. I know that this question I think was answered, but maybe other people have it. Is organic milk different than regular milk if you're talking about the recommended guidelines?
To my knowledge, from a fat and nutrition perspective, there really shouldn't be any difference between organic and regular milk.
Great. This question is I think the CoQ10, I think that's CoQ10, helpful with statins?
Sure, that's a great question. I know that some people have anecdotally found it to be beneficial. I am not personally aware of any evidence-based studies that recommend the use of CoQ10. So I can't say one way or another. I don't recommend for it or against it.
Great. And I think, Bob, you asked that question and another one here about medications. We do have our next webinar on the statins. So you may want to jump on that, and you can register to join us on June 15th for that. You may be able to learn some more about the statins. The next question is, are soy products not good for you, like tofu?
I think soy products are good for. Are there any specific concerns in specific that I could address? I mean, in general, I would say that they are considered reasonably healthy and, everything in moderation. So I wouldn't binge on soy products.
Okay. Yeah, I think that's a great advice. It goes along with the same things that we've heard along the way. Is highly refined canola oil heart healthy?
That's an interesting question. And with regards to the specifics of the different types of oils, I'm actually going to punt that to one of our upcoming webinars. I believe Dr. Penny Chris Etherton is giving another webinar. Is that correct? I believe it's July 16th.
Yep. Yeah.
So that would be a great question for her to answer. And I think she's going to take an even deeper dive into the diet and nutrition parts of that. So I think I would hold that question for her webinar.
Perfect. Perfect. All right. I am going to see who has their hands raised. We have answered all of the typed questions. So Jeffrey Glenn, I am going to unmute you and let you ask your question. Jeff, you should be unmuted.
Okay. Hi, and thank you very much for presenting today, Dr. Kulkarni. And I'm wondering, and thank you, Andrea, and I'm wondering if you can talk about grapeseed oil at all. I know you deferred to another webinar for somebody else's oil question, but I'm just wondering, that's what came up for me during this webinar.
Sure. Unfortunately, that is not my particular area of expertise, so I will have to defer that to the next webinar. But I'd be curious to know the answer to that too.
Yes, great questions. I'm looking forward to the July webinar. So the next question is from Steve Bridges. Steve, I'm going to unmute you and let you ask your question. It says you are self-muted, so if you want to unmute your own line, you should be good. There you go.
I do not have a question. I'm sorry.
Oh, that's okay. Well, hello, Steve. Okay. I think that is the end of the questions. So we do have another poll that we would like to give you guys to find out about what you've learned and how comfortable you feel after listening to this webinar. So if you would go ahead and answer for us after watching the webinar, how comfortable you feel. And just as a note, if anybody has any additional questions or you need additional information on the webinar series that's coming up, the rest of them, you can email me at andrea.baer, B-A-E-R, at mendedhearts.org. And the next session of the series, which you do have to register for, you have to register for each one individually, unfortunately. Somebody told me today that that was very cumbersome, and I agree, but there really is no other way to register for the entire series. So please bear with us on that manner and register for the next series. We have all of the registrations on our website at www.mendedhearts.org. And it's right on the home page. You'll see the Beyond the Numbers little graphic. If you click that, you can register for all of the webinars upcoming, and we look forward to doing that. All right, so I think that the poll is done. It looks like everybody has answered. I think, Dr. Kulkarni, you have helped some people feel a little more comfortable from the looks of it.
That's great. I'm happy to hear that.
Yeah, great. Okay. There's one last question that just came in. If you wouldn't mind answering it. They said she wants to know, and this may also be the nutrition and diet, but do you have any opinion on homogenized versus non-homogenized milk?
That's not a question that I've had come up before. And so I am going to defer that for the next webinar, but yeah, that's really interesting.
Yeah, I don't have any opinion on that either. So, well, I think that there's a lot of food questions that we can have answered, hopefully. Everybody keep your questions and join us again for the next one. So thank you all again. We really appreciate you joining us today. This will be recorded or it is recorded, and it will be on YouTube for future viewing and for all of our chapters to use for future support group meetings. So thank you all very much for attending. We have one very last poll that I'm going to push out, and then we will be done. So thank you guys so much for joining us. If you would just answer that quick question really fast before you jump off, I would like to thank you all for joining us. And Dr. Kulkarni, thank you for joining us and giving us such great information today.
Thanks for having me.
Thank you.